All right. Getting ready for your medical assistant internship interview. We've got you covered. Today's deep dive is all about prepping you for, those tough questions.
Oh, yeah.
Using some insights from this awesome new job guide, we're going to go way beyond just those surface level answers, so you can really stand out and show them you're ready
Absolutely.
to hit the ground running.
You know what I find really valuable about this guide?
Yeah?
It's how it connects those practical skills to a bigger picture
Right.
of patient care.
Yeah.
It's not just about, like, knowing how to do something. It's about knowing why it matters.
Okay. So let's just jump right in.
Yeah, let's do it.
I know one question that pops up all the time in medical assistant interviews is about taking vital signs.
Yeah.
It seems pretty basic,
Yeah.
but how can you make your answer really shine?
Think about it this way.
Okay.
You're not just rattling off numbers, right?
Right.
You're painting a picture of the patient's overall health. So those fluctuations in blood pressure
Yeah.
could point towards a heart condition. And a sudden spike in temperature might signal an infection.
Oh, okay.
So when you talk about taking those vitals,
Yeah.
blood pressure with a sphygmomanometer,
Okay.
pulse with a watch or a pulse oximeter,
Mm-hmm.
respirations just through observation,
Right.
and temperature using a thermometer, you're showcasing your ability to see those numbers as clues
Yeah.
in a bigger medical puzzle.
That's a really interesting way to look at it.
Yeah.
So you're not just demonstrating technical skill.
Right.
You're showing you understand the significance
Mm-hmm.
of those vitals.
Right.
Okay.
It's that deeper understanding
Yeah.
that will really impress your interviewer.
Now, what about assisting a physician
Oh, yeah, that's a good one.
during an exam? I imagine that's a common scenario
For sure.
where you really need to be a proactive team player.
Absolutely. It's all about anticipating needs and making the whole process smooth
Right.
and efficient.
Yeah.
I think a good way to approach this question is to kind of walk the interviewer through the steps. Talk about prepping the examination room beforehand,
Okay.
making sure all the instruments and supplies are like readily available, organized, ensuring the patient feels, comfortable, informed,
Right.
really creating that positive atmosphere.
Yeah.
And then during the exam, it's about being one step ahead,
Okay.
handing the physician instruments
Okay.
before they even have to ask.
Right.
Discreetly taking notes on the patient's chart
Yeah.
and maybe even, offering a reassuring word to the patient if they seem anxious.
Okay.
And of course, wrapping things up
Yeah.
by cleaning, restocking the room afterwards. It's those little details
Right.
that show you, take initiative and go the extra mile.
I can really picture that scene. Right. It's like a choreographed dance.
Yeah.
Where everyone knows their role and works together seamlessly.
Oh, that's a great analogy.
Yeah.
It's about working in sync to provide the best possible care.
Exactly. Now, shifting gears a bit.
Okay.
Let's talk about maintaining a sterile environment. I know this is super important in healthcare.
Yes.
But it can sometimes feel a bit abstract. How can you make your answer of infection control protocols really stand out?
It's about going beyond just listing the steps.
Okay.
And instead showing that you really understand the reasoning
Right.
behind each one. So
Yeah.
instead of just saying hand hygiene,
Yeah.
you could explain that you're aware of like how easily germs can spread through contact and that hand washing is like the first line of defense
Right.
in breaking that chain of transmission.
Okay.
You could even mention like the specific technique, for effective hand washing.
Yeah.
Like the importance of scrubbing for at least 20 seconds.
So you're not just saying, the rules, you're showing you understand the why behind them.
Exactly. Same with personal protective equipment.
Yeah.
Gloves, masks, gowns. It's not just about wearing them.
Right.
It's about understanding how each piece, acts as a barrier to protect both you and the patient.
Yeah.
And when you talk about disinfecting surfaces or disposing of biohazardous materials, emphasize that you're aware of the potential risks involved
Right.
and the importance of following those protocols to the letter.
So it's about painting a picture of a healthcare professional who takes those precautions seriously
Right.
because they understand the real world consequences.
Exactly. And, another point you could bring up is instrument sterilization.
Okay.
This is a great way to kind of showcase your knowledge
Yeah.
of how infections can spread through, contaminated equipment. Mention that you're familiar with the different sterilization methods,
Right.
like autoclaving or using chemical solutions,
Yeah.
and that you understand the importance of following those procedures rigorously
Okay.
to prevent cross-contamination.
Okay, I'm seeing a pattern here. It's about taking those, like, seemingly simple concepts
Yeah.
and weaving in a deeper layer of understanding.
Right.
Now, moving on to the administrative side of things.
Okay.
Let's talk about patient confidentiality. I'm guessing this is a question where you need to really demonstrate your commitment to HIPAA regulations.
Absolutely. And this goes beyond just saying, I'll follow hypo.
Right.
You want to demonstrate that you understand the core principles
Okay.
behind those regulations.
Yeah.
Respecting patient privacy, safeguarding sensitive information, and maintaining that, critical trust between healthcare providers and patients.
So how would you suggest someone approach this question in a way that really showcases their understanding of HIPAA's importance?
Think about specific examples
Right.
that demonstrate your commitment to those principles. So you could talk about how you'd only share patient information with authorized personnel,
Okay.
ensuring that you verify their identity and, their need to access those records.
Mm-hmm.
You could mention being mindful of conversations in public areas,
Right.
maybe stepping away from the reception desk to discuss sensitive details with a colleague, or using a lower voice,
Okay.
to prevent others from overhearing.
Right. Right.
And when it comes to digital records,
Mm-hmm.
you can talk about using strong passwords,
Mm-hmm.
logging out of systems when not in use,
Right.
and being aware of the risks
Yeah.
associated with sharing information electronically.
It's like you're building a fortress around that patient's information, taking every precaution
Yep.
to keep it secure.
It's about demonstrating that you understand the weight of that responsibility and that you're not just following rules because you have to,
Yeah.
but because you genuinely believe in protecting patient privacy.
Okay. Now imagine this. You're in a bustling clinic.
Okay.
The phones are ringing off the hook.
Oh, yeah.
Patients are arriving, and your schedule is packed.
Mm-hmm.
How do you tackle that challenge of scheduling multiple patients while ensuring everyone gets the attention they need?
This is where your organizational skills and ability to think on your feet really come into play. You want to demonstrate that you can handle that pressure
Right.
while maintaining, a calm and efficient approach.
Yeah.
I think it's helpful to break down your answer into key steps.
Okay, walk us through it.
Okay.
What would those steps be?
First and foremost, you'd want to mention that you understand the importance of prioritizing
Right.
urgent cases.
Yeah.
So if a patient calls with chest pain or a severe allergic reaction, they obviously need to be seen right away.
Right. Okay.
Then for routine appointments, you'd want to kind of explain your process.
Mm-hmm.
For creating an efficient schedule.
Right.
This might involve grouping similar appointments together,
Okay.
considering travel time between locations.
Yeah.
If you work in, a multi-site practice, and being mindful of the physician's availability and preferences.
It's like a giant puzzle
Yeah.
where you're trying to fit all those pieces together in the most optimal way.
Exactly.
Yeah.
And don't forget the human element.
Right.
It's crucial to confirm those appointments with patients.
Yeah.
Send out reminder calls or texts
Mm-hmm.
and clearly communicate any scheduling changes to the entire healthcare team
Right.
to prevent any confusion
Yeah.
or double bookings.
Right.
And of course, you want to mention your flexibility in accommodating those inevitable last-minute cancellations
Right.
or urgent requests.
So it's a blend of organizational skills, clear communication, and that ability to adapt to the ever-changing flow of a busy healthcare environment.
Exactly. It's about showing that you can stay calm, focused, and patient-centered,
Yeah.
even when the pressure is on.
Okay, one last question for this part of our DEM dive.
Okay.
EHR systems are everywhere these days
Oh, yeah.
in healthcare.
Everywhere.
How can you showcase your tech savviness when answering a question about your experience with EHRs?
It's not just about dropping names
Okay.
of software programs like Epic or Metasoft.
Right.
It's about demonstrating that you understand the power and the responsibility that comes with using these systems.
So what kind of details could you highlight to really impress the interviewer?
Think about the core functions of an EHR.
Okay.
Things like inputting patient data accurately,
Okay.
updating medical histories,
Mm-hmm.
retrieving information efficiently for physicians,
Right.
and ensuring that every interaction with the system upholds patient confidentiality. You could mention like specific skills,
Mm-hmm.
like data entry speed and accuracy,
Okay.
your familiarity with medical terminology, coding systems, and your ability to navigate different modules within the EHR software.
Right.
And of course, always emphasize the importance of, maintaining data integrity and security, following proper logout procedures, reporting any suspected breaches, and being aware of those, evolving cybersecurity threats.
So it's about framing yourself as someone who not only knows how to use an EHR, but
Yeah.
someone who appreciates its impact on patient care
Yep.
and takes data security very seriously.
You're not just a button pusher.
Right.
You're a responsible steward of patient information.
Yeah.
Okay.
Okay. Okay, we've talked about technical skills and administrative tasks.
Yeah.
But now let's dive into something a bit more nuanced. How to handle those tricky behavioral and situational questions
Mm.
that often come up in medical assistant interviews. You know, those questions that really taunt your judgment,
Right.
your composure, and your ability to think on your feet?
Yeah. It's all about showcasing your, soft skills alongside those hard skills, demonstrating that you can navigate those interpersonal challenges with empathy, professionalism, and a, cool head.
So let's start with a classic scenario. How would you answer a question about dealing with a difficult or anxious patient?
Ooh, that's a good one. This is where you really want to showcase your ability to remain calm and compassionate, even when faced with, challenging emotions.
Right.
You could start by acknowledging that you understand, how stressful medical situations can be for patients.
Yeah.
And then talk about the importance of active listening, really tuning into what the patient is saying, both verbally and non-verbally,
Okay.
and trying to understand their perspective.
I think that validation piece is so important.
Yeah.
Just making the patient feel heard and understood.
Absolutely. And you can even mention specific techniques you'd use,
Okay.
like reflecting back what you've heard to ensure you're understanding them correctly, or asking open-ended questions
Right.
to encourage them to express their concerns fully. And of course, always, maintain a respectful and reassuring tone,
Yeah.
even if the patient's becoming agitated.
It's about creating that safe space for the patient, letting them know you're there to support them through those difficult moments.
Exactly. And sometimes, a simple gesture like offering a glass of water or ensuring the patient feels physically comfortable can go a long way in easing that anxiety.
Right.
If the situation escalates, you could mention involving the physician
Yeah.
or supervisor, always emphasizing that your priority is ensuring both the patient's well-being
Right.
and the smooth functioning of the clinic.
Okay. Now let's talk about another scenario that can be a bit tricky. Making a mistake. I mean, everyone makes mistakes, right? Even in healthcare.
Oh, yeah.
But how do you address this in an interview without sounding like you're prone to errors? It's all about honesty and accountability. Trying to pretend you're perfect or that mistakes never happen will just come across as disingenuous.
Yeah.
Instead, focus on showcasing how you would learn from those mistakes
Okay.
and prevent them from happening again.
So how would you suggest framing that response?
You could start by acknowledging that, yes, mistakes do happen, but that you're incredibly meticulous in your work.
Okay.
You always double check everything.
Right.
You could then provide a hypothetical example.
Okay.
Maybe you noticed an error in a patient's chart, or you accidentally administered the wrong dosage of medication.
Ooh, those are some high stakes examples.
Right, exactly. But the key is in how you handle those situations. Emphasize that you would immediately report the error to your supervisor.
Okay.
Follow the proper protocol for documenting the mistake and taking corrective action.
Right.
And then, use that experience as a learning opportunity to improve your practices moving forward. So it's about showing that you understand the gravity of those errors and that you're committed to patient safety above all else.
Exactly. And that you're not afraid to, to own up to your mistakes and use them as a catalyst for growth.
Now, I'm thinking back to my own early days in a fast-paced work environment, and I remember those moments of feeling overwhelmed and pressured. How would you advise someone to answer a question about working under pressure in a way that highlights their strengths?
Ooh, this is your chance to shine. You want to paint a picture of yourself as someone who stays calm, focused, and efficient, even when things get a little hectic. And the best way to do that is through compelling story.
Oh, I love a good story.
You too.
So what kind of story would you suggest sharing?
Think back to your medical assistant training.
Okay.
Maybe there was a time when the clinic was like short-staffed,
Right.
or there was a sudden influx of patients, or you had to deal with like a particularly challenging case.
Yeah.
Describe the situation, the specific actions you took to manage that pressure, and the positive outcome you achieved.
So it's not just about saying, I can handle pressure.
Right.
It's about showing it
Mhm.
through a real-life example.
Exactly. And even if, the outcome wasn't perfect, you can still highlight the skills you demonstrated.
Right.
Maybe you stayed calm and collected.
Mm-hmm.
You prioritized tasks effectively.
Right.
You communicated clearly with your team members.
Yeah.
Or you went the extra mile to ensure that the patient's needs were met. It's those actions that really demonstrate your ability to thrive in a fast-paced environment.
Okay. So we've covered those tricky behavioral questions. Now let's shift gears and talk about ethics. These are some heavy-hitting topics.
Yeah, for sure.
But they're crucial for showcasing, your integrity and your commitment to doing what's right, even when it's difficult.
It's about demonstrating that you understand the ethical principles that guide healthcare.
Yeah.
And that you're prepared to uphold those principles even when faced with challenging dilemmas.
So let's start with a scenario that I imagine comes up quite often, a patient refusing treatment. It's a tricky situation.
Yeah.
Because you want to respect the patient's autonomy, but you also want to make sure they're making an informed decision. So how do you balance those two perspectives?
You can start by acknowledging the patient's right to make their own healthcare choices. Emphasize that you would approach the situation with respect, understanding, explaining the potential risks and benefits of refusing treatment in a clear and compassionate way.
It's about empowering the patient with information.
Right.
Not trying to coerce them into a decision they're not comfortable with.
Exactly. And you could also mention that you would encourage the patient to have an open and honest conversation with the physician.
Right.
Addressing any concerns or questions they might have. Ultimately, you want to ensure that the patient feels heard and supported, even if they choose a path, you might not personally agree with.
Yeah. It's about trusting that the patient knows their own body and their own needs best. Now, what about another ethically charged scenario? Witnessing a colleague violating a healthcare policy. It's never easy to confront a coworker, especially if you're new to the team. How would you approach this situation?
This is where, your integrity and your commitment to patient safety really come into play.
Right.
It's about understanding that those policies are in place for a reason.
Right.
To protect both patients and healthcare providers.
So how would you recommend handling this, delicately but firmly?
You could start by emphasizing that you value teamwork and collaboration and that you believe in, open and honest communication. If it's a minor infraction
Okay.
and you feel comfortable doing so,
Yeah.
you could mention speaking to your colleague privately, expressing your concerns and reminding them of the policy in question.
So a gentle reminder.
Right, exactly. Assuming it was an unintentional oversight.
Yeah.
But if the violation's more serious, or if you're not comfortable confronting the colleague directly, you could mention that you would escalate the issue to a supervisor or a compliance officer.
So it's about recognizing that sometimes those difficult decisions are necessary to ensure patient well-being.
Yeah.
And uphold the integrity of the practice?
Exactly. And it's about demonstrating that you're not afraid to speak up when something isn't right.
Yeah.
Even if it means, having an uncomfortable conversation.
Okay. Shifting gears a bit, let's talk about those essential work ethic qualities
Okay.
that every medical assistant needs to thrive in a busy healthcare environment. First up, organization and time management.
Yep.
I can imagine that juggling patient appointments, paperwork, phone calls, and clinical tasks can get pretty overwhelming.
Oh, yeah.
So how would you highlight your ability to, stay on top of it all?
Think about it like this. You're the conductor of an orchestra,
Okay.
making sure that all the instruments are playing in harmony to create a beautiful symphony of patient care.
Ooh, I like that analogy.
Yeah.
So what kind of system would you suggest implementing?
You can talk about using a combination of tools and techniques.
Okay.
Maybe you're a fan of color-coded calendars or to-do lists, or perhaps you rely on scheduling software to, keep track of appointments and deadlines. You can also mention the importance of, prioritizing tasks.
Right.
Identifying those urgent matters that require immediate attention versus those tasks that can be tackled later.
It's about finding what works for you
Mm-hmm.
and creating that structure.
Right.
That helps you stay calm and focused amidst the chaos.
Exactly. And don't be afraid to mention that you're always looking for ways to, like, improve your efficiency. Maybe you've read books or articles on, like, time management techniques, or you're always seeking out new tools and technologies that can, streamline your workflow. It's that commitment to continuous improvement that will really impress, your interviewer.
Speaking of continuous improvement, let's talk about accuracy.
Okay.
In healthcare, even small errors can have significant consequences. How would you showcase your commitment to precision and attention to detail in your work?
It's about going beyond just saying, I'm detail-oriented.
Right.
It's about providing specific examples
Okay.
that demonstrate your, meticulous approach.
Mm-hmm.
You could talk about, double-checking your work,
Right.
carefully reviewing patient charts, medication orders,
Yeah.
and ensuring that all documentation is, clear, concise, and error-free.
It's about creating those checks and balances
Right.
in your workflow to, minimize the risk of mistakes.
Exactly. And you can also mention that you're comfortable asking for clarification when you're unsure about something.
Yeah.
It's better to ask a question
Yeah.
than to, make an assumption
Right.
that could potentially harm a patient.
It's that humility
Yeah.
and that commitment to patient safety that will really, shine through.
Mm-hmm.
Okay, last but not least, let's talk about teamwork.
Oh, yeah.
Healthcare is a team sport,
Huge.
and medical assistants play a vital role in that team dynamic. How would you highlight your collaborative spirit and your ability to, work effectively with others?
Think about those key qualities that make, a great team player.
Okay.
Things like clear communication,
Mm-hmm.
respect for others,
Mm.
a willingness to help out,
Mm.
and, and a positive attitude.
Yeah.
You could mention specific examples from your, training or previous work experience
Right.
where you demonstrated those qualities.
So paint us a picture.
Okay.
What kind of examples would really showcase those teamwork skills?
Okay, so maybe there was a time when you had to step in and assist a colleague who was struggling with, a heavy workload. Or perhaps you took the initiative to organize a team meeting
Right.
to improve communication and workflow.
Yeah.
You could also talk about your ability to listen attentively to instructions, provide constructive feedback, and resolve conflicts in a professional and respectful manner.
It's about showcasing those soft skills that make you a valuable asset
Yep.
to any team.
Exactly. And don't forget the importance of, celebrating successes together.
Oh, yeah.
You could mention that you enjoy, acknowledging your team members' contributions and creating, a positive and supportive work environment.
Right.
It's those little gestures that can really foster a strong sense of camaraderie
Right.
and make coming to work each day, a joy.
Okay, we've covered a lot of ground here, from handling difficult patients to working under pressure to upholding ethical standards and being an awesome team player. But there's one more crucial element we need to discuss, and that's your future goals. A medical assistant internship is just the beginning of your journey in healthcare.
Yep.
So how do you convey your ambition and your vision for your career path?
It's about showing that you're not just looking for a job.
Right.
You're looking to launch a fulfilling and impactful career in healthcare.
Okay.
And the best way to do that is to be, genuine and enthusiastic.
So what kind of things should you highlight when discussing your future goals?
You could start by expressing your eagerness to learn and grow during the internship.
Right.
Mentioning specific skills or areas of knowledge you're hoping to gain.
Okay.
Maybe you're particularly interested in learning more about a specific specialty,
Right.
like cardiology or pediatrics,
Okay.
or perhaps you're drawn to the administrative side of healthcare and want to gain experience in, managing patient records or coordinating care.
It's about showing that you're already thinking ahead.
Yeah,
Have some ideas about where you want to go in your career.
exactly. And, you don't have to have everything figured out right now.
Right.
It's perfectly fine to express that you're still exploring different options
Okay.
and are open to new opportunities.
It's that openness to learning and that willingness to embrace new challenges that will really impress your interviewer.
For sure.
Now, what about those long-term goals? You mentioned those as well.
Absolutely. It's a great way to, to showcase your ambition and your vision for your future in healthcare.
Okay.
Maybe you dream of becoming a registered nurse or a physician assistant someday.
Right.
Or perhaps you see yourself, you know, managing a clinic or specializing in a particular area of medicine.
It's about painting that picture
Yeah.
of where you see yourself in 5 or 10 years, demonstrating that you're already thinking, like, strategically
Right.
about your career trajectory.
Exactly. And even if those goals evolve over time,
Yeah,
it's that forward-thinking mindset
right.
that will make you stand out as a candidate.
Okay, now before we wrap up our deep dive, all right, let's talk about one last crucial element of the interview process.
Okay.
And that's asking your own questions.
Oh, yeah. That's important.
It's a chance to showcase your curiosity, your engagement, and your genuine interest in the internship.
It's also an opportunity to, to gather valuable information
Right.
that will help you determine if this is the right fit for you.
So what are some questions you could ask that would really impress your interviewer?
You could inquire about the specific training opportunities provided during the internship.
Okay.
Will you have a chance to shadow experienced medical assistants, observe different procedures, or gain hands-on experience with various, clinical and administrative tasks?
Yeah.
You could also ask about the clinic's culture and work environment.
Right.
What's the team dynamic like?
Yeah.
Is there a strong emphasis on mentorship and professional development?
It's about getting a feel for what it would be like to work there every day
Yeah,
and whether your values and goals align with those of the practice.
exactly. And don't be afraid to ask about those things that are important to you,
Right.
like opportunities for growth within the organization, the availability of continuing education programs,
Right.
or the clinic's commitment to work-life balance.
It's about showing that you're not just looking for any job.
Right.
You're looking for a place where you can thrive both professionally and personally.
Exactly. And, one more question you could ask is, what are some of the qualities that make a medical assistant truly exceptional in this practice?
Ooh.
That's a great way to gain insights into what they value most in their team members.
Yeah, it's like getting a glimpse into the secret recipe for success
Yeah,
in that specific environment.
exactly. It shows that you're, eager to learn and grow and that you're committed to exceeding expectations.
All right, we've covered a lot of ground in this deep dive.
Oh, yeah?
From mastering those technical skills, to acing those behavioral questions, to showcasing your work ethic, your ethical compass, your teamwork skills, your future goals, and even the art of asking insightful questions.
It's about presenting yourself as, a well-rounded and capable candidate
Yeah.
who's not just looking for a job, but a launching pad for an amazing career in healthcare.
Exactly. And remember, confidence is key.
Yes.
Believe in yourself. Let your passion for healthcare shine through and show them that you're ready to make a real difference in the lives of patients.
Your future as a medical assistant is bright.
Yeah.
Go out there and make it happen.
That's it for today's deep dive.
Yeah.
We hope you found this journey into the world of medical assisting insightful and empowering.
Absolutely.
And remember, we're here to support you every step of the way.
Best of luck with your internship interview.
Yeah.
You got this.
Okay, before we sign off, I want to leave you with one final thought-provoking question.
Okay.
As you embark on this exciting journey in healthcare, what specialty within this vast and ever-evolving field speaks to you the most?
Is it the fast-paced, adrenaline-pumping world of emergency medicine, the meticulous precision of surgery,
Wow.
the compassionate care of pediatrics, the intricate workings of the human brain in neurology?
The possibilities are endless. So take some time to explore those possibilities.
Yeah.
Delve into different specialties
Yeah.
and envision yourself thriving in a healthcare setting that truly ignites your passion.
Because at the end of the day, it's that passion that will fuel your success and make your career in healthcare not just a job,
Right.
but a calling.
That's a beautiful thought to end on.
Oh,
So until next time, keep learning, keep growing, and keep striving to make a positive impact on the world.
we're cheering you on every step of the way.